Hey folks, this is the first case for your pediatric block, the triplets of Toronto. So we have here a 39-year-old woman who is visiting her relatives in Toronto. She originally hails from West Africa. She is currently 31 weeks pregnant. While shopping, she notices a clear vaginal discharge. Concerned about this, she reports to the nearest hospital and is promptly diagnosed with preterm premature rupture of membranes. Intense labor contractions ensue, and she quickly delivers a set of triplets with different APGAR scores. So, Group A's assignment, the names are listed here. You are to deal with this problem. Triplet A has come out, and the APGAR's score at 1 minute is 4. The child appears pale, is very weak, has a very weak and declining pulse. Um, Questions for you. What are the steps you would take in this neonatal resuscitation? What would you do if there was a question of meconium aspiration? So basically, we're asking you to summarize and go over some of the key elements of the neonatal resuscitation protocol. Later, triplet A survived and is currently on a ventilator in the NICU. Triplets B and C did much better in comparison and did not require an acute resuscitation. But 4 days later, there's a lot of buts in this case, while handling her child in the NICU, the mother notices that the child, which in this case is triplet B, seems to turn blue and become limp on feeding or any other kind of exertion. So in this case, the question for Group B, names listed here, is what do you think might be going on here? What is your approach to investigating and diagnosing and treating this condition? 3 weeks later, the mother arrives in the ER with her now 3-week-old daughter. This is triplet C. She complains that her child has been sleeping all day, has not produced the usual number of wet diapers, and is uninterested in breastfeeding. On examination, you note a pale, listless child with poor muscle tone and tachypnea. And we actually have a video. This is actually a real-life case. Note the tachypnea, indrawing, etc. So, questions for you in Group C is firstly, how would you take a proper pediatric history? What questions would you ask? These include things like vaccination history, obstetrics history, travel history, etc. Adolescent interview questions. Also, other questions is what disease process do you think is going on in this case? What is the differential diagnosis here, and what organisms might be involved? It is likely because this mother presented so quickly that the Group B strep status was unknown, and prophylaxis might not have been given. Why is this important to note? And how would you work this patient up, and what treatment would you initiate on spec? Okay, so triplet C actually did very well thanks to your treatments. But 12 weeks later, the mother has come back in and has noticed that in the last day, the child has been increasingly short of breath, coughing, but is otherwise feeding well, drinking well, and is not excessively somnolent. On examination, you see a 10-pound child in no acute distress, but with vital signs as listed here. You see some evidence of bilateral intercostal indrawing. On auscultation, you hear fine crackles bilaterally, but no wheezing or stridor. So the assignment for Group D is what do you think is going on here, and how would you treat it? How could this have been prevented? And what other respiratory problems can manifest at this time? So your assignments are due this Friday, and I look forward to seeing them.